I can tell you that half of the patients that end up on my operating table or anyone else's operating table don't have elevated cholesterol. A lot of them because they're on medication, some of them just naturally low cholesterol levels. When you really look at the statistics, LDL cholesterol is essentially meaningless when it comes to predicting heart disease risk.
Hey guys, thank you so much for watching our videos. If you'd like to support us some more, you can explore our homemade natural skincare products at purelytallow.com. Thank you so much for supporting my small business.
Hey everybody, welcome to the Carnivore Revolution. I'm Serena, and today my special guest is Dr. Philip Ovadia, who is a heart doctor and the author of the book called Stay Off My Operating Table. And he really does want to help you to do just that. So Dr. Ovadia, thank you so much for being with us.
Yeah, it's great to be back with you here, Serena, and great to be able to talk to everyone in the community again.
Yeah, so I think your message is so important because we are all, as a whole, the world and specifically America, we are afraid of fat because fat makes us fat and fat causes heart trouble. And so I want to jump right in to the fat causes heart trouble thing. And I think what most people don't know is most people have never heard of Ansel Keys. And what they don't know is that the reason America is in the metabolic state that it's in, with everybody, so many people, majority of people being overweight and or obese and metabolically unhealthy and sick with autoimmune disease and all that, I personally blame Ansel Keys for that. And so can you start there and just talk about how, he had confirmation bias on every study that he ever did about fats. And I'd just like to talk about how you think, how that happened with him and how he was allowed to get the voice that he had.
Yeah, I think it's a great stepping off point for the conversation. And, I'll say some people have referred to Ansel Keys as the biggest mass murderer in history. And, I won't confirm or deny that, but, there may be a legitimate point because we look at the path that we were set down upon. And Ansel Keys was the primary driver of this. And, so to go back, we're talking about the 1950s and we're talking about heart disease, which in the 1900s in the United States was a rare disease. It was undescribed in many of the leading physicians of the times, when they would talk about their career-long experience, maybe they saw a case of heart disease, but, it was a very rare disease. And throughout the early 1900s, that started to change. And by 1955, heart disease had become the number one killer in the United States. And our President Eisenhower, while in office, has a heart attack. And this appropriately sets off the alarm bells. And, a call for action went out. What can we do about heart disease? And of course, before you can correct a problem, you need to understand what's causing it. And there were really two leading theories about what was leading to the epidemic of heart disease. Well, actually, I should say there were three competing theories. Two of them were food related. And Ansel Keys was a scientist who put forth this hypothesis that fat that we were eating in the diet, and specifically saturated fat, was the primary driver of heart disease. There were other scientists, most notably Dr. Yudkin, who was saying it was sugar in the food. And then there were a third group of scientists that were saying it's not the food, it's smoking and cigarettes that were the primary driver of heart disease. And, all of them had some validity. And, maybe on some level, all three were right. But the saturated fat diet heart hypothesis is ultimately what won out. And Ansel Keys, and depending who you talk to about this, who you believe, was somewhere between a, just poor scientist in that he allowed himself to be very biased and to only, look for sort of confirmation of his theories, to outright fraudulent. And there's concern that, his seminal paper basically ignored data that he had access to. a very important and actually one of the most, I would say, one of the best done nutritional interventional trials that he led. The results were not published for a long period of time after completion of the trial. And, basically because those results did not support Ansel Keys' hypothesis that, saturated fat was the primary driver of heart disease in the diet. So, irregardless of all of that, we got led down saturated fat as the primary driver of heart disease. And this then led to a number of actions. We can look at the original US dietary guidelines that were released in 1980, focused on reducing the consumption of saturated fat. We could look at all of the fat-free foods that came out of that kind of movement. And then we can follow that up with the pharmaceutical interventions that then became focused on lowering blood cholesterol levels. And, the bottom line that I look at from a big picture is we've been talking about saturated fat as the primary driver of heart disease for over 50 years. Our consumption of saturated fat as a society here in the United States has gone down during that time. And the incidence of heart disease continues to go up, continues to worsen. And, that just doesn't make sense, right? If saturated fat's the problem, we lower saturated fat intake, heart disease goes up. Those three things don't line up. And that's what I kind of focus on a big level.
So as a heart doctor, as a heart surgeon, what kind of diet do you recommend to your patients, both sick and well?
Yeah, so the most important thing, I think, when it comes to a dietary approach that's going to minimize your risk of developing heart disease is elimination of processed food. And, processed food has a number of concerning components to it. We can point to the highly processed carbohydrates and sugar that are in it. We can point to the highly processed fats, these polyunsaturated, vegetable and seed oils, which were specifically promoted in our food supply to replace saturated fat. And yet we see that these things are actually harmful when it comes to heart health. And so, but on a broad, to keep it simple for people, I just start with eliminate processed food. You want to eat real food, the things that grow in the ground, the things that eat the things that grow in the ground. Now, personally, I think the best version of that, the most nutrient dense version of that is an animal-based carnivore diet. But I don't tell all my patients you need to be on a carnivore diet. I think a carnivore diet is an option for heart health. And I want people to really focus in on that and understand that. Eating more red meat is beneficial for your heart health. And that's the message that I want people to understand. It doesn't mean you need to eat only red meat. You can if you want to, but red meat has never been the problem when it comes to heart health. And it is the most nutrient-dense food that we can eat as human beings. And ultimately, getting the processed food out and getting more animal-based protein into your diet is going to be the best thing for your heart.
And so what about people who come to you, let's say a middle-aged man who has high cholesterol and doesn't have any other markers of heart disease or ill health? What do you tell somebody like that? Should they also continue to eat a carnivore diet?
Well, the first thing is with that situation is I want people to have the right markers of heart health. And the vast majority of people that come to me with that concern, with that question, have not had the right markers of heart health. So this is the first thing I want people to understand. First and foremost, if you are a middle-aged male and you are concerned about heart health, you need to have a coronary artery calcium scan. I don't care about the blood work. I mean, I do care about the blood work, but the blood work isn't telling us, do I have heart disease or do I not have heart disease? The coronary artery calcium scan and or a CT angiogram of the heart. So these are imaging studies looking at the blood vessels in the heart, and they tell us, do I have heart disease or not, atherosclerotic heart disease? How much do I have? And then that's something that we can then follow over time for progression. So that's first and foremost. Now, when it comes to blood work and specifically the cholesterol question, I refocus people. I want them to understand it's not the quantity of your cholesterol, your LDL cholesterol that matters. It's the quality that matters. And this is when we start looking at things like particle sizes. Do you have big LDL particles? Do you have small LDL particles? Are you insulin resistant, which is going to influence the types of particles that you have? And, related is, do you have high HDL cholesterol? Do you have low triglycerides? This is the way that we need to be looking at blood work if we're concerned about heart disease. We need to bring in things like inflammation. We need to bring in things like insulin resistance, which are very important risk factors for cardiovascular disease. So we can get a complete picture of, what is your risk profile when it comes to heart disease.
So let's say somebody goes and gets the CAC scan and it comes back, and what number are we looking for? What number is, concerning? And if you do come back with some plaque, is there anything you can do about it? Because I have heard that doctors usually say there's nothing you can do about it if it comes back high. But I have personally seen people on the internet, but I have actually seen people whose CAC scores go down.
Yeah. So, plaque is going to be a marker of disease progression is what I want people to understand. So, ideally your score is 0, meaning that you have no calcified plaque on the coronary artery calcium score. If it's not 0, there's a continuum of risk. There isn't one cutoff number that you don't have to worry about. It's just a continuum of risk, and it's going to be understanding, how old you are, other factors. But what oftentimes happens is, many doctors view the CAC score as a black or white one-time thing. You have disease, you don't have disease. And I use the CAC score, and many others use it as a marker of progression of disease. So whatever your score is today, we then want to know, what is your score a year from now, 2 years from now? Is it going up? Is it staying the same? Is it going down? And you're right, these scores can go down, and I've seen it in my practice. But what I tell people is the most important thing is we just stop it from going up. Because if it's not getting worse over time, that means that you're at lower risk for something bad happening, for having a heart attack. And so the goal that I work with patients on in my practice is, let's just stop it from getting worse. And sometimes we see it go down. Sometimes we just see it not getting worse. And that's a great goal to have. And then, yes, depending on how bad it is and other factors, maybe we need to go further in investigating your disease state today. Maybe there are things that might be needed to be, considered, like stents or bypass surgery. But the CAC is the screening test. I liken it to the mammogram for breast cancer. It can show us early in the disease process that there's something going on. It can give us a warning sign, and we might need to investigate further. But we at least need to be aggressive now about managing this disease that we've uncovered.
So, and I know it's subjective depending on the person and the history and what other markers they have and all of that. But so what advice do you give to somebody who does have a CAC score? Not extremely high, but, and I don't even know what that would be. I don't even know what really high would be. Obviously we want 0, but yeah. So you have a patient, a middle-aged man, and it comes back with some plaque. His cholesterol is a little bit high, but everything else is okay. What kind of advice do you give there? Do you tell them to keep eating a lower carb diet? Obviously keep the processed foods out, right?
Yeah. So, again, this is where we want to dig into, do you have inflammation? Do you have insulin resistance? What are your LDL particles look like? Are they small particles or large particles? If someone, let's say has already, and again, this is a common scenario now, because people typically don't hear about the CAC score until they start paying attention to their diet. And so, they've gone on a low carb diet. Maybe they've reversed their insulin resistance. Their inflammation has gone away. And then they get their first score, and their score isn't 0. And it's like, okay, what do we do? Somehow, the 50-year-old gentleman that comes and, he's been doing keto or low carb or carnivore for 6 months, and he had 49 and a half years of not keto, carnivore, low carb, and his CAC score is 500, and everyone says, oh, look what the keto carnivore did to you, right? And it's just crazy to think that way. But that's kind of the world that we're in. And my advice to those people is, we know that insulin resistance is a primary driver of heart disease. It's a much bigger risk factor than LDL cholesterol is. We know that inflammation is a very important risk factor for heart disease. And so if you've reversed your insulin resistant, you reversed your inflammation, and your LDL quality looks good, you don't have a lot of small, dense particles, you have large, fluffy LDL particles, then the advice is usually sit tight, and we're going to get another scan in a year, maybe even in 6 months in some situations, and we're going to see what's happening to that score. Because if your score is 500 today and your score is 500 a year from now, and you've been doing low carb, keto, carnivore during that year, you can be pretty, reassured that it's probably not the low carb carnivore that caused it. It was the 49 years before that. And now we've stabilized your disease and we're on a good path. But, that's a very difficult conversation to have in our environment today because, it's so against the mainstream. Yet I'm doing it with patients on a daily basis in my telemedicine practice. We're having great success. We're seeing people stabilize their scores, and, we make the decision together. And again, it's another important point here. I don't make the decision for the patients. We have the conversation about what's the risk of, having this high of an LDL cholesterol, lowering it with medications, changing your diet around, all of these things the patient needs to understand. And that's why it's pretty intense work that I do with my patients. These aren't 10-minute visits. I spend usually an hour to an hour and a half with the patients on a repeated basis. It's not a one-time visit either. We work together for a year, and longer, and we figure this out. We check the blood markers over time. We're keeping a very close eye on it. We're not ignoring the LDL cholesterol, which is, what some doctors perceive or, have accused me of on social media, to be quite frank. We're just managing it in a different manner. We're having a deeper understanding of cholesterol and what role it plays. And quite frankly, I think it's somewhat, it's a very superficial way that the medical system in general treats cholesterol. They just look at one number on one panel and think that that is the end all and be all when it comes to heart disease.
Yeah. So somebody starts a low carb or carnivore diet and their cholesterol goes up. That's very normal, especially in the beginning. They say, don't have your blood work checked at the beginning. What happens if it stays up? What's your recommendation for that? And I'm talking, maybe 300, 350 for the total, but let's say pattern A and pattern B are okay. You have more of the pattern A. What's kind of your recommendation there for somebody whose cholesterol does go up? Because that's scary. And there's always the lean mass hyper responder kind of scenario. But what do you recommend in that kind of a situation? And does it matter how strict you are on carnivore? If you take weekends off every now and then, or you take a week or two off here and there, what does that do to your numbers?
Yeah. So the good news is we understand a lot more about this phenotype. Dave Feldman, Nick Norwitz, Matt Budoff, lots of people have done a lot of great science around this to help us understand it. And, we now have, and I personally now have, a very deep clinical experience with patients like this. And there are a number of factors to look at. Like I said, it's not as simple as one number. You do want to look at the overall picture. Is there inflammation? Is there insulin resistance? Is there plaque? And is that plaque progressing? And, and then you make the decision. And, there are some things that you can do to bring down that cholesterol level. We know that for most lean mass hyper-responders, introducing a little bit of carb into the diet or reintroducing a little bit of carb into the diet will oftentimes dramatically bring down the LDL cholesterol. Now, does that change their risk at all? That's still an open question that we're understanding, but it's an option. It's an option to take medications, and it's an option to just continue very close, careful clinical observation that, you understand that there may be some risk with this LDL cholesterol level, but there also may not be risk with that LDL. And of course, we're getting more and more scientific study and clinical experience as time goes on with this situation.
So
now,
you mentioned lowering. Sorry, go ahead.
Yeah, just one more thing I did want to mention, though. It's actually not the typical for your LDL to go up and stay up when you start a carnivore diet, or even low carb diets, we'll say more broadly. The totality of the experience actually shows us that for most people, if the LDL goes up, it's a temporary phenomenon while they're losing weight. And overall, the studies that have looked at this across the population, the LDL doesn't tend to go up on low carbohydrate diet. So that's something else to understand, because the perception out there is that everyone that does low carb diet sees this. And the reality is that it's not everyone that sees it. And the people that do see it initially, oftentimes it, goes back down over time as their weight stabilizes.
But you have to kind of be consistent with carnivore for that to happen, right? You can't be on again, off again. Then your body is just constantly adjusting, right?
Right. I mean, that's kind of a given for any scenario. If you're not adhering to whatever the strategy is, you can't really comment on what effects the strategy is having. So that is important to note as well.
Okay. And you mentioned lowering cholesterol, like with medications. And so there's also concerns with having cholesterol that's too low, right? Aren't there studies, there's research that shows that having too low of cholesterol can increase your chances of like dementia and Parkinson's, right?
Yeah, there are a number of concerns around low cholesterol levels and an increase in all-cause mortality. And some researchers have tried to explain this away by saying that, cholesterol levels will tend to go down when people get very sick. So, if you, for instance, are testing people's cholesterol levels in the hospital and you see that they're sick with just about anything, infection, cancer, heart failure, you can name the disease. When people get very sick, their LDL tends to go down. Now, that would give me concern about running an LDL cholesterol that's very low. But the researchers will look at that and say, well, that doesn't mean that LDL is causing them to die. It's kind of a very cognitive dissonance, I call it, because they'll say, well, when your LDL is high and that's associated with disease, it's causative. But when your LDL is low and it's associated with disease, it's a result of the disease, and therefore we're going to ignore that part of it. So yes, I do have concerns about people running very low LDL cholesterol levels over the long term. We know that LDL plays many, many important roles in our body. It's part of our immune system for fighting infection, for fighting off cancer. Cholesterol is a very important, fuel for our brain and structural, component of our brains. And there's concerns that, you could see neurologic effects with very low cholesterol levels over time. And again, this is another reason that I try and refocus people on, it's not about the quantity of your cholesterol, it's about the quality of your cholesterol. Because what I see in my role as a heart surgeon is I see a lot of people that have had low cholesterol levels for long periods of time, low LDL cholesterol levels for a long period of time, end up on my operating table. And you have to say, why is this? And the reason I think it is because you can have lower amounts of LDL cholesterol, but it's still primarily poor quality LDL cholesterol, and that's going to get you into trouble. And that's why over and over again, I try and refocus the discussion to cholesterol quality versus cholesterol quantity.
Yeah. So, okay, story time. So I have a friend who had what they call a mini heart attack. I guess we still call him that, right? About 8 or 9 years ago. And since then, he has followed all of the advice from his doctor. He, no added sodium to anything, only lean meats. They have red meat once a month as a treat, lots of fish, a little bit of olive oil. Everything is very, very lean, very, very low fat. Again, no sodium. So it's basically the DASH diet that he is following. And so the red meat is a treat. We're basically on opposite diets here. And in a conversation that we had where I was saying, oh, I heard about this. This was right after I started Carnivore. So I was telling him I've been doing this for 8 months. It's so amazing. I feel so great. It's, healed so many things. And I just started saying about his heart and, that this might be worth trying. And his exact words to me were, I'm already doing everything my doctor is telling me to do, and I'm still so sick. Why would I try something you read about on the internet? And I think that is most people's mentality, that they are so sick, right? These are people who they are afraid for their lives, literally. And he is afraid for his life. He is already doing everything his doctor said. And I believe that. I believe he's adhering to it. He is a rule follower, right? And so what do you say to somebody like that is still so sick? He's inflamed. He doesn't feel good. I mean, he's got stuff going on. So what do you say to somebody like that feels like they're doing everything they possibly can and they're like getting worse?
I mean, I would just say, if you're following all your doctor's advice and you're getting worse, why are you still following that doctor's advice?
Well, it's mainstream advice.
Yeah, it is. But go find different advice because it's not working for you. And you know what? Maybe you're an outlier somehow, but it's not working for you. Mm-hmm. And that's the point of all this. Because, quite frankly, if someone comes to me and, I'm telling them to do carnivore and they're getting worse for whatever reason, that's not what we typically see. But, if you are getting worse on any advice, why would you keep following that advice? That's really what it comes down to. And yes, many doctors say this is the best approach to the problem. And maybe it is. I'll concede that. But it's not the best approach to the problem for you if you're getting worse. And, people just need to be open to thinking different ways and looking at different advice from different doctors. And yeah, I agree. You want to be suspicious of maybe random things you come across on the internet. But, there are doctors like myself and many others that have shown low carb, carnivore approaches, having amazing results for patients, and they stop feeling horrible. And, that's what it comes down to. I had a conversation with a patient just earlier today. New patient comes to me for a consult. Similar situation. He's taking all this medicine and he doesn't feel good and he's having issues. And I just said to him, you need to figure out what your goals are. Because we can say, let's just accept for a moment, statins are going to lower your risk of heart disease, of having a heart attack. But the statins are also having side effects that are making you feel horrible. Would you rather, live 5 years, not have a heart attack, but feel horrible that whole time? Or would you rather live 2 years, have a heart attack, drop dead, but you felt better those 2 years? And maybe it really does come down to it. I don't think it's that dramatic for most people, but that's an option that you have to decide, that you can decide. And unfortunately, most doctors don't have that conversation with patients. Their only focus is on the LDL cholesterol. We got to lower the LDL cholesterol. You got to take this medication. There's no other risk. And then they, overinflate the benefits. They minimize the risks, and they really don't give the patients the option. They don't empower the patients to decide what's important for them. Because for many people, if that's the scenario that you're facing, they'd say, you know what, I'd rather live a shorter period of time with a better quality of life than the longer period of time with the worst quality of life.
So what about the stats? Do you know the stats for people who have high cholesterol and how many, like when you, I didn't really word that right. So when you operate on somebody, the amount of people that you operate on, do you know the statistics there? Like how many of them have high cholesterol versus how many have lower cholesterol?
Yeah, I know them very well. And I can tell you that half of the patients that end up on my operating table or anyone else's operating table don't have elevated cholesterol. A lot of them because they're on medication, some of them just naturally low cholesterol levels. When you really look at the statistics, LDL cholesterol is essentially meaningless when it comes to predicting heart disease risk. And, you can't get around it. I mean, people try and explain that and I get attacked all the time on social media, and they talk about, all these confounders and how I'm, ignoring the data. But, you can go back to the first studies that were done. So the Framingham heart, study that everyone has heard about, it was the first study that demonstrated association between blood cholesterol levels and heart disease risk. And that risk was only at very high levels of total cholesterol we were measuring at that time. But in subsequent studies, LDL cholesterol. And again, we know that they were finding people who had a genetic problem related to their cholesterol in that study. But below those very high levels, total cholesterol of 300, there was no association between LDL cholesterol and heart disease. We just got more, great recent data. So I mentioned, Dave Feldman's work, the lean mass hyperresponder study, as we're recording this, just published earlier this week. And what the initial cohort, look at that study did, and what they did was they took 100 lean mass hyperresponders. They actually pulled out 80 of them and compared them to another heart disease study. It's called the Miami Heart Study. But what I want to, and, they show the comparison between these two groups, one with very high LDL cholesterol levels and one with, more normal LDL cholesterol levels. And one of the most important findings in that, and they did CT angiograms to look at how much plaque these people had, there was absolutely no relationship between people's LDL cholesterol levels and how much plaque they had in either of the groups, the lean mass group or the comparison group from this Miami Heart Study, which was not people doing low carb diets. There was no relationship between LDL cholesterol and how much plaque they have on their CT angiograms. So, in the end, again, I think, I shouldn't say I think, I know that LDL cholesterol, the amount of LDL cholesterol is a lousy heart disease marker. The quality of your LDL cholesterol is a different story. And that's something that we should be paying more attention to.
And I argue with people all the time online too about the 50% number. And people say 50%, that's half. And I'm like, right. So can you say, oh, it's the fat and meat that's causing it? It's the high cholesterol that's causing somebody to end up with a cardiac issue. If it's half, like you can't lean one way or the other if the number is half, right?
Yep. Yeah, very much so. And, there are just so many holes in the diet heart hypothesis that it really, on some level, it's frustrating that we keep talking about this because honestly, even the proponents of it have moved on, right? You hear them now talk about, well, it's not LDL, it's LDL particle counts, or it's ApoB, and they keep coming up with these other measurements. And, those are better measurements. They take into account different things. And so, again, I like to zoom out. I like to look at big pictures. It's now been 40 years since statins were introduced. Again, our LDL cholesterol levels as a population have been decreasing over that time period, and heart disease is not going away. It is the number one killer. It has been increasing once again in incidence over the past 10 years. So we're obviously missing something, and it's time for a new focus. It's time to refocus on insulin resistance, inflammation. These are the primary drivers of heart disease risk. and let's focus on that. And that leads us down a whole different pathway, because we know that the best anti-inflammatory, anti-insulin resistance diet that you can go on is a low carbohydrate diet that doesn't incorporate processed food.
So let's talk about sodium real quick. So sodium used to be, the big thing people would talk about all the time. And it used to be that your blood pressure had to be 150 or more in order for it to be considered high blood pressure. And then they lowered it to 140, and now they've lowered it to 130, and they consider that high blood pressure. And it's just interesting to me. I'm sure the insurance companies are involved in all of that, but now somebody who has had lost my train of thought. So now somebody who has had a blood pressure number of, let's say, 135 for the last 20 years suddenly is being told that their blood pressure is too high, and they want them to take a medicine for that. And I know some people are still scared of sodium, just like they're scared of fat. In my water bottle alone, filling it up 4 times a day with my electrolytes, I get 4,000 milligrams of sodium, and that's not including my food. That is astronomical compared to the numbers out there. And you know what? My blood pressure is like 120. And it hasn't changed from before I became a carnivore and started using the electrolytes and putting extra salt on my food. And so I just think that's interesting. I just want to talk about the blood pressure issue for a minute, on why the high number is going down, and what we can do to avoid being scared of that also.
Yeah, so the story around the pharmaceutical treatment of blood pressure very much parallels the pharmaceutical treatment of cholesterol. And we started with this idea that high blood pressure is bad. And, honestly, there's more evidence to the high blood pressure is bad than there is to the high cholesterol is bad. But we started treating people's blood pressure and lowering their blood pressure with medication, and it wasn't having the desired outcome. High blood pressure is a risk factor for both atherosclerotic heart disease, what we've been talking about, as well as stroke. And as they treated people's blood pressure, that risk wasn't changing as much as it was thought it should. So the answer must be, well, we need to lower people's blood pressure more, instead of looking at maybe lowering people's blood pressure with medication isn't the right approach. And instead, we should be looking at what's causing the high blood pressure in the first place. And oh, by the way, that happens to bring us right back to insulin resistance. And if you're treating the blood pressure with medication and you're not addressing the underlying insulin resistance, maybe that's why, it's not working. But instead, the pharmaceutical approach says, well, we must just need to lower it more, start it earlier. And that's why we see these guidelines constantly being changed. Now, the impact of salt on blood pressure, or the impact of sodium on blood pressure, again, this is complicated by the fact that for the vast majority of Americans, the source of sodium in their diet is processed food. And so sodium in processed food may very well be problematic, but that doesn't mean sodium from a good quality, sea salt is a problem. And again, when you say you're getting 4,000 milligrams of sodium, it's not coming from processed food. It's coming from, sea salt. And those are two very different things in my mind. And that's, again, where we see some of these, some of these conflicting results around sodium. So, I don't think that most people need to be limiting sodium. Quite frankly, the limiting sodium as a way to control blood pressure has failed miserably in the trials. And, it's just lousy advice that doctors keep giving because they don't know any better. They don't hear any different. And, year after year, U.S. News and World Report says the DASH diet is the best diet we have available. And, they don't even acknowledge really that carnivore exists. And they refuse to look at the science on low carb. And they just keep repeating this message. And, that's what doctors hear, just like patients hear. And so they're just trapped within that paradigm.
As one of our final notes, in your professional opinion, what do you think is making everybody so sick?
Yeah, like I said, I come back to processed food first and foremost. Yeah. And, you can talk about the various components there, but, at a high level, if you just eliminate the processed food, you get better. And that's what it comes down to for me. And that's the message that people should be getting. And unfortunately, the US dietary guidelines, the low fat movement have all pushed us towards a more processed diet. And again, the experiment has now been run. We have the results, and the results are disastrous. And so we need to change course. And I know, of course, your audience has already gotten that message and subscribed to that. And so my message to them is, if you're feeling better and, everything you can point to looks better, and all your doctor can do is point to one number on a blood panel that in their mind contradicts that, keep doing what you're doing, what's making you feel better. And, and then if you need to, find a doctor that can help you dig a little deeper and really understand, what's behind that one number, because the story is not as simple as one number on your blood panel.
Yeah, I agree. When people are always saying, oh, where are the studies? Where are the studies? Like, I'm the study, I'm my own experiment, and I feel amazing. And here's so-and-so's, experiment. And I could turn people to 50 or 75 carnivores and say, look at their success story. If that doesn't speak, I don't know what does. People's personal experiences can be just so valuable and so shocking to see how much better so many of us have gotten and how much better we feel from just having given up the processed foods and gone on a low carb diet. And I don't think everybody needs to be a carnivore, but I do think everybody should give up the processed foods and sugar and seed oils for sure. So now, how do people find a doctor like you? Like, I have a functional medicine doctor. He says he hasn't prescribed a statin in 22 or 23 years, something like that. And he does a pretty good job, but he's not a proponent of the carnivore diet, which is fine because all of my blood work is really good. But if I started having bad blood work, I'm not really sure what he would say. He seems perplexed. He doesn't really understand why this is happening to me and why I am doing so well after 3 years. But how can we find a doctor like you, or how can people come see you through telemedicine?
Yeah, so people can come see me through telemedicine, and you can go to ifixhearts.com, or you can go to any of the social medias, ifixhearts, and come find me, come work with me and my team. I now have an amazing team. It's not just Dr. Ovadia. We have Lisa, our nurse practitioner. We have 2 health coaches currently with us, Krishna and Jen, all amazing. It's a team effort. And we are here to empower the patients. More broadly, I advocate for people to go to the Society of Metabolic Health Practitioners. It's the best way to see if there's a local practitioner maybe that you can connect with. These are all people that are committed to metabolic health first and foremost. And I think that's the approach that, can guide us and can guide patients to achieve the goals that they're looking for. But most importantly, like we mentioned earlier, if your doctor's advice is making you worse, if it's not making you better, find another doctor, find different advice, because the answer is out there. And overall, I just advocate for people to take charge of their health. Don't just take what the healthcare system is giving you. And that may take some extra effort. Quite frankly, your insurance may not pay for it because it's not what they're interested in. And so you might have to put more effort in. You might even have to put some money into it. But you can get better. You can be empowered to take charge of your health. And you really shouldn't settle for anything less.
Awesome. Dr. Ovadia, thank you so much for spending the time with me.
Always a pleasure, Serena.
And thank you so much for watching. Be safe, be well, and I'll see you next time.